Welcome to the Weiser Center for Prostate Cancer, a sanctuary for hope where you and your family can thrive, from diagnosis through treatment, with patient-centered care from our team of experts and the wisdom of advocates and former patients.
The number one goal of our center is to make the best possible patient experience.
We're exceedingly enthusiastic and happy to introduce this truly multidisciplinary approach to prostate cancer care here at Michigan Medicine.
Michigan Medicine has the best technology, the best people, the best research. There's no doubt about that. Our goal now is to create the best patient experience so that when patients come in, they feel they are on the team.
One of the things that we want all our patients at the Weiser Center to know, as well as their partners, is that we work together as a team.
The whole team is involved to make sure that we deliver patient care effectively, and also to make sure that patients thrive in survivorship.
Patients feel like they're not just seeing that one person who's with them on that day, but they've got access to this incredible network of people with tremendous expertise.
Prostate cancer, there's a whole lot of treatment options that are involved with it. There's collaboration between the various professionals. It makes it a lot easier for the patients.
So even though you may have your physician assigned, your nurse, we all work together as a team to make sure that your experience is as supportive and as comfortable as we can.
Patients with prostate cancer are in a unique situation where they can oftentimes choose a treatment type. Both physicians are in the room together with the patient in that first consultation.
People come and expect 100% cutting-edge cancer care, but they don't usually expect to be as supported as what we provide for them and as connected to us as a team so that they feel like they're practically family members. We're their family members and they are ours.
Patients are often at a loss when given a cancer diagnosis. They don't know where to look for reliable information. Our doctors have taken the time to create specific resources for the patients.
All the research shows that when you educate people about what to expect, they have more realistic expectations, they get less distressed. We use that research knowledge to design our care to help patients anticipate what to expect.
There are a number of resources available to help patients and their loved ones learn more about prostate cancer, to learn more about the staging, grading, treatment options, what similar men have chosen in a similar situation, and why, and what happened to them.
The Weiser Center provides connections to resources within Michigan Medicine and outside sources that ranges from social work, therapy, spiritual care, and other mental health resources that is appropriate for the patient.
Sanctuary means that they have professionals that can deal with any side issues that the patient might have. Everything from finance to art and therapy and meditation. It goes on and on.
We are a very supportive team. You're going to have support along every step of this. There's multiple layers of support that you're going to be offered through our program.
Patients can know and trust that when they come to our facilities, our website, everything has been vetted by their doctor.
At the Weiser Center for Prostate Cancer, we are going to give patients the opportunity to speak to someone who's walked in their shoes. We call these peer mentors.
Peer mentors are former patients who have sat in the clinic chair, have gone through everything that new patients are going through, and can really provide a unique understanding, guidance, and support.
I think the peer mentors are important because it's someone who has been through the same process that you're going to be going through. They come with credibility.
We know how distressing cancer care is and that it's not just distressing for the patients, but also for their family members. And so we include them in sort of our sanctuary of care.
When we see a person diagnosed with prostate cancer, it is our job and responsibility to take care of not only that patient, but all the other individuals who interact with that patient as well.
We regard emotional well-being of our patients as being just as important as the cancer care.
It affects the whole person and the whole person's family.
Some people, will find that they are feeling a bit of disbelief, anger, frustration. There can be a whole range of emotions, and their partners may also be feeling this way as well.
We have an embedded sex therapist in our program, so every patient who comes for prostate cancer treatment is scheduled to meet with a sex therapist to evaluate sexual side effects from prostate cancer treatment. This is not really typical of other cancer centers.
I meet with patients and their partners to talk about their sexual needs and how this is impacting them emotionally. My goal is to meet you where you are.
So that is a very unique offering of the Weiser Prostate Cancer Center, which is rarely found anywhere else, and we're pretty proud of it.
Patients at the Ronald Weiser Center for Prostate Cancer have a patient navigator.
That person is connected to every patient from the beginning and helps them literally navigate from specific space to space, from clinician to clinician.
And the navigator's purpose is to, as much as possible, take away all those little tiny stresses that can often exist when someone interfaces with a big and complex health system like this one or like any one that a patient might go to.
You have one point person that can help answer questions, connect you with the right person and the right resource. Our navigator is the hub of your care team.
The goal of the Weiser Center for Prostate Cancer is to make the University of Michigan, the Rogel Cancer Center, be the easiest place to be treated for prostate cancer in the country, if not the world.